Hey guys, it's Tina. Here's my portfolio. I hope you enjoy it. It has to do with my journey over time and throughout this BSN program. So here's my contents page. I'm not going to tell you all about it, but just part of the requirements. So here we go. This is a picture from 10 years ago. This picture was taken at the family orientation years ago when we had our orientation for our BSN to invite our family. And this was the picture taken during that time, and I love this picture. My girls were really little, and I've loved this picture for a very long time. Graduation. My graduation was 10 years ago. So this picture on the left, of course, is from my pinning, and then the right picture is my graduation from getting my associate's degree. So Polk has changed over that period of time in the past 10 years from being a community college to becoming a state college, and even the pin has changed for the upcoming nursing classes. Even the scrubs have changed from white to black and red. So here's my pin, my old and tattered pin to the new pin, and the lettering has even changed from PCC to PSC. So was I really going back to school? Well, that was not my plan. When I finished my ASN program, I was burnt out. I did not want to go back to school. That was not ever my plan. But because things have changed over time and jobs are requiring it, my coworkers and I talked about it and figured we'd do it together. But things happen. Everybody's life changes. Mine changed. So some of my coworkers finished or went to another school. I went back to school and got my AA, but I did not finish my BSN until now just because of health concerns. So I did take the professional role transformation class, and that was back in 2012. And I did graduate with my AA in 2014. And then I took another break between 2014 and 2017, mostly because there were changes to Polk during those times, and I also had some health concerns, so it took me a while to go back. So this is the reason why, the majority reason why I didn't go back for some time. I was diagnosed with breast cancer in February of 2016. Made me change as a nurse. I was a patient, so it made me look at things differently, opened my eyes to a lot. But when I finished with my last surgery, I was bound and determined to go back to school to get my BSN. I wanted to go to school, I wanted to start, and I wanted to finish. So I went back, and I wasn't going to stop until I was done. So despite it all, even after getting my double mastectomy, I did become CLC certified, which is a lactation counselor, and this is to help moms breastfeed. So kind of an oxymoron. I don't have breasts, but I help moms breastfeed, but I love to do it. I did not breastfeed my girls when I had them, so over time I just wanted to help my moms breastfeed that I care for. So that's what I do, and I love it every day. So here's our BSN learning outcomes that we've all come to grow and love, that we've seen from the beginning of time. I did my reflection paper on these learning outcomes, and I'll talk about that on the next slide. So here's my reflection. Here's everything I learned in the past 2 years and what I've grown, how I've grown as a nurse. So my reflection from the BSN outcomes is, number one, I've learned how to treat patients the right way. despite their race or insurance carrier. That's just the moral thing to do, the right thing to do. Number two is I've collaborated with doctors. I've gained rapport. From being a NICU nurse to now a mother-baby nurse, I have felt and grown more as an RN than I ever have before and felt. Number three, BSN outcome. By working with Ellen Lynch in informatics, I learned some of the backside to Cerner, and I've become a super user also previously, and I love every bit of it. Number four, I've come to respect and follow my protocols. Number five, I ask questions, and if you don't yourself, you should. Don't ever be afraid to ask a question. We're also doing the new standard of practice, which is bedside shift report. So by doing that, we should also be asking the patients at the bedside to involve them and not being just a patient in the bed. Number six has to do with using our video interpreter system. We use Stratus for our language barrier patients. It's not the funnest thing to use at times because it does take a lot of time, but it's very helpful for our patients. So it has helped tremendously. Number seven, by being a CLC, I advocate for my moms who want to exclusively breastfeed. We at our hospital are becoming more baby friendly, and breast is best is our motto. So there are challenges some days, but some days it's great. But I love helping moms become more successful. And then number eight, my educational goal within the next 5 years is to start my master's and to have a job in the professional role as a informatics specialist. This slide has to do with our project that we had to do. Mine focus on Pitocin use, the guidelines, making sure nurses are using it accurately, and making sure they have an order. Big part of my project was showing nurses to look for an order. If there's not an order, to get an order, and to verbally have it in the chart before Pitocin is given. Sometimes that can kind of be hard to do, especially in an emergency situation, but it is something that nurses need to make sure there is an order for, so they are not falling out of scope. I've learned myself from this that I have fallen out of scope due to this. So this Plan Do Study Act is being fixed. It's not fixed in every chart, but it's getting there. So as you can see, Pitocin is a dangerous drug, and it actually is the number 2 high-risk medication at our hospital. So this is something I definitely wanted to fix. So what is Pitocin? Pitocin is, it's used for speeding up labor, contractions, inducing labor. It's used a lot for postpartum hemorrhage. And the bottom right does talk about the risk factors for a mom for having a hemorrhage. So here are some of the orders that are in the chart. Not every chart is fixed, but it is a work in progress. But these are the orders that nurses should be looking for and making sure is in place before Pitocin is infused. If it is not in the chart, it needs to be added as a verbal order. So this is something I have cared for, and I look forward to caring for until it is completely fixed, because this is a big deal. So in the next 5 years, as I stated before, I want to be in informatics. I like data. I like to build stuff. I like numbers. I like to help people. So all of it combined is the reason why I want to go into nursing informatics. So it may take me a little bit to start going back to school again, but priority-wise, I need to take a break, but I do plan to go back. So what exactly is nursing informatics? Well, big word that has to do with nursing informatics is the word support. You're supporting the whole hospital wide, and without research being done and nursing informatics being a part of it, the two would not go together. So I love informatics. And my resume. This resume was actually built recently for a job I applied for in informatics. I did not get the chance for an interview, but this resume is focused on that type of job. Here is my IHI and NIH certificates that we had to complete. So this is just showing them. And then this picture is from actually last month from my breast cancer walk. As you can see from the first picture to now, how grown my girls are and how changed and different they look over the past 10 years. And I am thankful and blessed by having them in my life, and I couldn't have gotten through it without them, and I'm very grateful. And last but not least, I wanted to congratulate not only myself but all of you. It's hard to believe December 13th, the day of graduation, is right around the corner, and I hope to see you there. I'm very excited to walk again and to receive another degree. Thanks, guys, for watching. I hope you enjoyed.